Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.
Gateway Sports Medicine brinda atención de calidad en Laredo y las áreas cercanas, ofreciendo servicios de medicina deportiva para todas las edades. Le damos la bienvenida al Dr. Eduardo Garza, médico de medicina deportiva. El Dr. Garza brinda su experiencia a Gateway Community Health Center, lo cual ayudará a sus pacientes a que continúen siendo atletas de alto rendimiento. Con el regreso a clases, evalúe a su atleta estrella hoy y dele la bienvenida al Dr. Eduardo Garza a Gateway Sports Medicine.
Hello and welcome to Gateway Today, your go-to source for all things Gateway Community Health Center. I'm your host, David Cash Vasquez, and in today's episode, we're focusing on nutrition and diet, patient registration, enhancing our pharmacy services, and you can access our clinics in Laredo, Zapata, and Hebbronville. First up, we're talking about the importance of nutrition and diet in maintaining good health. Our resident nutrition expert, Marisa Benavides, joins us to discuss the benefits of a balanced diet and how to make healthy food choices. All right, ladies and gentlemen, so we've made it into the office of Miss Marisa Benavides. She is the jack of all trades when it comes to all things nutrition, diet here at Gateway Community Health Center. Right, Marisa? You're going to tell us a little bit about what you do here at the clinic, right?
Sure. Yes, I am a certified diabetes care and education specialist. I'm the only one here at Gateway, and I think I'm the only one here in Laredo as well. And I recently completed my certificate in training for obesity weight management for pediatrics and adults. And I am a registered dietitian as well. So we want to help people be healthy and live their best life. And a lot of times people don't want to come see me because they already know what they're doing wrong. And those are the people I really want to see. We want to make sure that they understand, like, we're here to help you through those barriers. Life is messy. It's hard to do the right things every day. We're here to work with you, help you figure out how to get around the obstacles that are getting in the way of you living your best life and your healthiest life.
Tell me about the Diabetes Institute, because it's not what people would think it is. When you hear the word institute, people automatically think a school, they think it's a place where I go, but tell me about that and your role in the institute itself.
Well, I'd like to say that I'm a part of, I guess, the creation of it, but it's really the brainchild of our CEO, Elmo Lopez. And he wanted to try to figure out how we can provide complete comprehensive care and highest standards of care for all the diabetes patients that walk into our facility. So it's not a separate building, it's just a standard of care that each person will receive, and whichever provider they decide to go see, the standards are going to be maintained across each department. There's a lot of communication between departments so that the pharmacy and the providers and the dietitian and our administration are all working together in unison to help that experience and to improve the quality of care for our patients. And we have come a long way since we've implemented this institute. And so we have seen drastic improvements in outcomes in A1C and diabetes control over the last 3 to 5 years.
So it's safe to say that through the Institute, all of the departments work together for better patient outcomes.
Exactly. Yes, talking to each other and working in harmony. And so we know each department knows what the other department is doing. And so it just creates a better patient experience overall for the patient.
So what I want to do now is I want to sort of jump into a healthy food plan and just a breakdown of what we should be intaking into our bodies on a regular, normal basis. So we're gonna do that with you right here, right now. So, all right, y'all stay tuned, sit and don't move, because we got that coming up for you right here on this episode of Gateway Today.
Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other health care needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.
Gateway Sports Medicine brinda atención de calidad en Laredo y las áreas cercanas, ofreciendo servicios de medicina deportiva para todas las edades. Le damos la bienvenida al Dr. Eduardo Garza, médico de medicina deportiva. El Dr. Garza brinda su experiencia a Gateway Community Health Center, lo cual ayudará a sus pacientes a que continúen siendo atletas de alto rendimiento. Con el regreso a clases, evalúe a su atleta estrella hoy y dele la bienvenida al Dr. Eduardo Garza a Gateway Sports Medicine.
Hey, so we're back with Gateway Today here with Marisa Benavides, our registered dietitian here at Gateway Community Health Center. And earlier we were talking about healthy eating, a balanced diet, and how to improve our lifestyle through healthy eating habits. And so, Marisa, I want to toss it over to you because I want to know how to build a healthy plate, and you're going to show us, right? So tell me, what is it that my plate needs to have so that I can live a long, healthy life?
Okay, well, starting off, the basis of the plate should have vegetables. And this is a method called the Idaho Plate Method that helps us have some flexibility and can have some cultural variations in the way we build our plate. And it's a really nice tool because there's really no right or wrong way to eat, and there's not one set diet for any individual, but it gives them some flexibility. And so when we see this plate, we notice that half the plate is filled with vegetables. Do you eat vegetables regularly?
I try to.
Okay.
I try.
Should you be eating vegetables?
Every day or with every plate, yes. I think, right? So, but I'm looking back over here and I'm like, some of that looks good, but let's focus on this plate right here. This is the plate we need to focus on, okay?
Okay, yes, so definitely cutting back on sugars is very important. Sugars are sometimes food that we should be enjoying on small occasions and small amounts, but we should be eating vegetables on a daily basis, and that's a big challenge for people. Sometimes they don't like it, sometimes they don't really know how to prepare it. And one of the things that I hear frequently from patients is they really don't know what to do with them. You know, in their mind, most of my patients are thinking of that bag of vegetables Normandy that come with the broccoli, the cauliflower, and the carrots. And, you know, maybe their mom steamed it for them and made them eat it when they were a kid. And so when I talk about eating more vegetables, that's not what I'm talking about. I'm talking about filling your plate with delicious, yummy, amazing tasting vegetables on a regular basis. And they can be frozen, but they can be fresh, they can be canned. It really doesn't matter.
And that was going to be one of my questions was, does it matter whether the vegetables are frozen? I buy frozen vegetables, fresh vegetables. Does it matter in what form they come or the way I eat them?
At the end of the day, I just need you to eat them. Whatever is easier for you and your preference, and that works, okay? But again, you know, sometimes we don't really know how to prepare them, and it takes a little bit of practice. And we do have classes on, you know, ideas on how to prepare them. But for me, Pinterest is my friend. I like to search yummy, delicious vegetable recipes and try maybe a new recipe once a week, once every other week, because if we were to make our vegetables the same every time, they get boring and they're just not that enjoyable. And so we think about chicken. It's such a versatile protein, right? And we can eat chicken every day, but we would never consider eating chicken boiled without seasoning on a daily basis. That would get old really fast. So we want to take that same approach that we apply to the chicken, and we can grill it, we can bake it, we can stir fry it, we can air fry it. You know, there's so many things we can do it. We can saute it with other vegetables.
Do the same thing with vegetables.
Exactly. And so we season them differently, and chicken can be eaten every day. And so if we take that same mentality and apply it to vegetables, then of course, now they're yummy and delicious and enjoyable. And it's a little bit easier to get ourselves to do that. But it does take practice. It's not something that if you're not used to eating vegetables that you're going to be great at from one day to the next.
If you need more information on a healthy, nutritional, balanced lifestyle, then I encourage you to come and visit Marisa Benavides right here at Gateway Community Health Center. Marisa, thank you for your time. I appreciate it.
Welcome.
And again, remember, your health is your wealth, so make sure you take care of it. Our thanks to Marisa. And for those who may be struggling with meal planning, well, Gateway offers a variety of nutrition services, including counseling and education on healthy eating. Be sure to check out our website for more information. Next up, we're discussing the process of patient registration right here at Gateway Community Health Center. Our Chief Technology Officer, Danny Campos, joins us to walk us through the steps and answer any questions you may have. All right, so we're downstairs in our first floor pediatrics clinic area, and Danny, we've started to incorporate tablet technology, right, touch technology into the patient registration process, right?
Correct.
So when a patient shows up, they receive the tablet, and then from there we just go through the process, right?
Pretty much. You show up, you say, hey, I'm here for my appointment. Our staff in the front, they will hand you a tablet, and you pretty much just follow the steps. All the signing for consents and everything happens within the tablet, and it automatically goes into our system. So no more paper, printing out, and then scanning the physical paper in. You know, it's just a very lengthy process. So this makes it easier for everyone. So I don't know if we just get started. So what you do is, right now we're using a test patient, and you just get started. And the first thing it shows you is your address. If you were to change your address, this is where you change it. My address hasn't changed, so we'll leave it. Continue, zip code. So all of this is just to verify your demographics. An email address.
It's almost like, instead of filling all this out, all the information's already stored here.
Correct.
Based on my patient registration.
Based on your patient
And then I just
registration.
go through the process, and that's it. I can see
Correct.
my physician from here.
Correct. So what the tablet does, it brings the information that we have in the system over. And all you're doing is verifying it, making sure nothing has changed. So if nothing has changed, you just click continue, continue, continue. Email address, I would highly suggest add an email address. So that's another communication tool we can use. And you just go through the process, And if this is already in our system, it's already gonna be filled out. You're just verifying.
So once everything's already verified and we ask for the communication that we want, how we want to communicate with the clinic, everything's been verified, we confirm it, front desk receives it, and
That's
then
it.
we're ready to go in and see our doctor.
That is correct.
It's that simple, huh?
And then remember that you can do this from the comfort of your home if you get that text message 3 days prior to your appointment. So let's just go through the steps. Yes. I'm gonna put no for the health insurance.
And so the process is the same for any patient, whether they have insurance, they don't have insurance, they have Medicaid, Medicare, they all go through the same process
correct.
of getting registered to see their physician.
That is correct. Now, when it comes to policies and things like that, you only do it once a year. In this case, this patient hasn't done it yet. So we're gonna go through all the policies. So what you do is you just sign, right? So we're gonna sign test and continue. And then this is a notice of privacy practice.
Right.
So again, this patient hasn't done it. So, and this is just, legalities of, this is giving us the right to pretty much see you as a patient.
Right.
So again,
So no pen necessary. I sign everything on the tablet.
Correct.
Done deal.
All right, so let's just do test. And then a phone number. We'll put the clinic's number because this is a test patient. And we'll just do that. We are the father. And then a couple more 6. Our general consent for treatment. This is for telehealth services, which is one of the things that we are offering now too.
What typically would take 20 to maybe 30 minutes filling out on a piece of paper has now been accelerated to 5 minutes or less.
That is correct. And also with the option of doing this from home, you don't have to do this here, right? So I'm gonna do Danny test. I accept.
So there you have it, ladies and gentlemen. We're making it easy for you to become a patient right here at Gateway Community Health Center. Our thanks to our Chief Technology Officer, Danny Campos, and his team for making all of this possible and making it easy for you to come and see a physician right here at Gateway Community Health Center. Come visit us today.
Thank you.
A big thank you to Danny for making things easy for those who want to become patients right here at Gateway. If you'd like to become a patient, make sure you visit gatewaychc.com for more information. Coming up, we're headed over to the pharmacy department to talk about enhancements happening right here at Gateway Community Health Center. We'll talk to Iracema Perez, who will tell us all about it. So stay where you're at. More Gateway today on the way.
Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other health care needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.
Gateway Sports Medicine brinda atención de calidad en Laredo y las áreas cercanas, ofreciendo servicios de medicina deportiva para todas las edades. Le damos la bienvenida al Dr. Eduardo Garza, médico de medicina deportiva. El Dr. Garza brinda su experiencia a Gateway Community Health Center, lo cual ayudará a sus pacientes a que continúen siendo atletas de alto rendimiento. Con el regreso a clases, evalúe a su atleta estrella hoy y dele la bienvenida al Dr. Eduardo Garza a Gateway Sports Medicine.
Welcome back to Gateway today. Well, we're talking about enhancing our pharmacy services right here at Gateway Community Health Center. Our Director of Pharmacy, Iracema Perez, joins us to discuss the latest advancements in pharmacy services and how they benefit our patients. All right, ladies and gentlemen, we are here at Gateway Community Health Center, and as part of us offering medical, dental, and behavioral health services to our patients, we also offer pharmacy services. And with me is our Director of Pharmacy, Ms. Iracema Perez. And Ms. Perez, thank you for joining us. I want to talk about some special programs for our patients today, but before we jump into all of that, tell me a little bit about the pharmacy services and what patients can expect from Gateway through becoming a patient here at the clinic.
Okay, great. So we do have a pharmacy, an in-house pharmacy at our main clinic, which is on 1550 Papas. We also have a pharmacy in our South Zapata Highway clinic. So those are to service our patients of Gateway. However, we also service patients who are in Zapata County as well as in Hebronville. Right. We also service patients who are in our Shiloh clinic. So what we'll do is we'll fill the prescriptions here out of the 1515 Papas, and then we will deliver the medications to those locations.
So like somebody comes here, they visit with their provider, they get a prescription, they can come right here to our pharmacy, which we'll kind of jump into right now in a second. But if they're a patient in Zapata, Heronville, even on the north side of town, they can get a prescription filled from us here.
That's right. So the prescriptions are sent to us electronically. So they can be sent from Zapata, from Heronville, from Shiloh, as well as our LC South clinic, which is one of the latest ones that we've added. So we will receive their prescription here, we will fill it, and then we will ship that out to that location, and the patient will pick that up over at that location.
So tell me also about these special programs, because that's why we wanted to kind of pull you out of work today, give you a little time to kind of get a break from the pharmacy. The pharmacy is extremely busy, but tell me about these special programs that you have going on with pharmacy.
Right. So one of the greatest advantages of this particular setup with our pharmacy is that we do have what we refer to as special programs. So we go, we've made agreements with different opportunities that are out there. So one of the programs we have is our Pfizer RX Pathways program. So this is in collaboration with Pfizer RX, and so they'll provide medications, Pfizer medications at a reduced cost. So if you qualify, all of these programs are based on eligibility. So if you qualify, you can receive medications from the Pfizer program at a $10 copay.
That's great.
Yes, it really is great, because Pfizer does have a wide range of medications as long as it's on their approved formulary, and they tend to be brand, not generic medications. And so at a copay of 10, that's a very good price for them.
Right. So are these programs available to all patients of Gateway?
They are eligible. They are available to the patients, but they have to meet the eligibility requirements, and those requirements are set by the Pfizer RX program. So if they meet their criteria and they qualify, then they're eligible to receive their medications as long as it's on the approved list that Pfizer sets out, because they have their own formulary. If it's on the formulary, they will be able to receive that 30-day supply for a $10 copay.
Excellent. This is excellent news. Now, tell me about the Lado a Lado program.
Great. So we also have the Lado a Lado behavioral health program. So this program is sponsored by Methodist Healthcare Ministries out of South Texas. So they do sponsor this program. Again, it is a program that you have to meet the eligibility requirements. And if you do meet the eligibility requirements and you receive a medication that's based on their list, you will receive that particular medication at zero copay.
So the pharmacy is working hand in hand with all these different organizations, and then we've also got our different areas of focus within the clinic, behavioral health being one of them, and this benefits our behavioral health patients, right?
Exactly, it certainly does. So if they do qualify, they do have underlying conditions like hypertension, diabetes, pre-diabetes, and or depression. That is one of the qualifications, plus a couple more things. They are able to receive those medications, and they receive them at a zero copay.
So not just behavioral health, but our medical, right? So anybody that's going through our Gateway Diabetes Institute or getting diet, nutrition help from our team, like Marisa Benavides,
Right.
and those folks, they also qualify for this program, right?
Yes, if they qualify
If they meet
if they meet all of the eligibility requirements that are set out by Methodist.
Now, there's a third program.
There is a third program, which is our family planning program. So this is out of the state of Texas, Department of Health and Human Services. So if they qualify, again, everything is based on qualification. If they qualify, they receive the medications under that program, also at a zero copay.
So no money out of pocket if I qualify, and all I need to do is be a Gateway patient.
Right. These opportunities are for our Gateway patients. So when they go through our registration process, they are screened, they are given the opportunities of all the special programs, that the eligibility requirements are reviewed, and if they qualify, they are going to be placed into the programs.
Excellent. All right, so we're gonna take a little tour of the pharmacy. We're gonna walk in there. We're gonna kind of see some of the things that are happening within pharmacy here at Gateway. So follow us into the pharmacy. Are you ready?
Yes.
All right, let's do it. So this is where all the magic happens,
This
right?
is where all the magic, this is where all the hardworking people are. So this is my pharmacy team.
Right.
So we've got my technicians are over in the back, my pharmacist station is here, and our clerks are in the front. They're the ones who greet our patients when they drop off. So they drop off their medication prescription here with us. And then of course, it's gonna be sent back over to our technicians or our typists.
Right.
It then goes on into our filling station, and it comes back to the pharmacist station for that final check. And then of course, it's bagged and put away for the customer pickup. So pickup and drop off is all here at the beginning.
And so tell me a little bit about that process for the rural areas, right? So you've got Zapata, Hebbronville, even our North Clinic, right? They don't have a pharmacy. Those prescriptions, you receive them and then fill them from here, right?
So I've got one technician dedicated. Every day I kind of, we had different people working on it, but one technician will be working on specifically prescriptions coming from the rural. And so they're the ones looking for them. We know who the providers are. We're basing ourselves by zip code. And so once we retrieve them electronically, then of course, at that point, they go ahead and type them. They fill them. They're designated by different colored baskets. Blue is this is our technician working on Zapata and Hebron. For today, they're designated by blue baskets, so we know that those are the ones going to the rural. Once we get those, any prescription that comes to us by 4 o'clock, is going to be prepared that day and it's going to be shipped out that evening. We do FedEx them overnight. We have to have these ready by 5:30 when our FedEx guy comes. And then of course they're sent. So we do track the medications. We do pack them well, especially when it comes to cold products like our insulin products. So we do pack them very well. We also include a thermometer that we track. So it's a continuous tracking. Next morning, our girls over at the rural sites receive it. We drop that into a logger that gives us a whole graph, so I'm able to tell if I maintain that medication at the appropriate temperature based on the manufacturer's specifications to make sure that that product is good.
So with the technology, with the advances, making sure that patient care is at its high peak, its ultimate, and it doesn't stop with just our medical or dental or behavioral health, but it also happens here in pharmacy. Iracema, my hat's off to you and your team, constantly pushing the bar even higher so that we maintain high quality healthcare. My thanks to you again for your time. And if you want to become a patient and get the ultimate in pharmacy services, join us, gatewaychc.com. Our thanks to Iracema and her staff in pharmacy who are available to answer any questions and provide medication counseling, so make sure you check out our website for more information. Finally, we're highlighting access to Gateway Community Health Center with multiple locations throughout the area. There's sure to be a location near you.
Welcome to Gateway Community Health Center, where for thousands of residents in Webb, Jim Hogg, and Zapata counties, we provide a vital link to quality healthcare services that might not otherwise be available. But what most people don't realize is that these 6 clinics and the services they provide are open to everyone. Our mission is quite simply to provide quality healthcare for all, regardless of your ability to pay. As a nonprofit organization, we're a lifeline to thousands of individuals with limited resources who cannot afford traditional health insurance. Our services include child and adult primary care, women's health, dental health, specialty care, urgent care, weight management programs, diabetes care, behavior health services, pharmacy services, and much more. And the best part is, everyone qualifies for our services and registering is easy. We even have certified counselors available to help with health insurance applications and Medicaid assistance. When it comes to general healthcare services, adult primary care is a top priority. This includes the diagnosis, treatment, and prevention of acute and chronic diseases, as well as immunizations and screenings for diabetes, high blood pressure, cholesterol levels, and more. For those in need of hospitalization, we have a hospitalist program that coordinates care from admission to discharge. It gets better. Our pediatric care services are provided to newborns, infants, and children up to the age of 18, including well child and acute care, immunizations, and medical checkups. Our specialty care services include behavioral health counseling and psychotherapy for children and adults. We even have an urgent care clinic open to the public after hours for acute non-emergency issues. In terms of women health, we offer breast and cervical cancer screenings, diagnostic exams, and at no cost to eligible women, Pap tests and mammograms. Gateway Community Health Center is a true gateway to good health, providing numerous healthcare services to all who come through our doors. We extend lives through proper medical care and attention, and no one is ever turned away. With clinics all over Laredo, Zapata, and Heronville, Gateway Community Service is a click, phone call, or a drive away. We offer extended hours Monday through Friday at our central clinic located at 1515 Papa Street in Laredo, Texas, Monday through Friday from 8 a.m. to 9 p.m. and Saturdays from 9 a.m. to 12 p.m. For more information on Gateway Community Health Center, simply call 956-795-8100 or visit our website, gatewaychc.com. So come in today and experience the quality healthcare services that you deserve at Gateway Community Health Center, where our mission is to provide quality healthcare for everyone.
That's going to do it for us and this installment of Gateway Today. Don't forget to visit Gateway Community Health Center for all your medical, dental, pharmacy, and behavioral health needs by visiting gatewaychc.com or follow us on all social media for updates and upcoming news and events. Until next time, remember, your health is your wealth, so make sure you take care of it.